Hi everyone, welcome to my live video. Welcome to Center of Balance. I'm the acupuncturist, Sunampoa. Hey, today our topic is learn acupressure points or learn acupoints for lower back pain. Now, do you suffer from lower back pain? Or your family suffer from lower back pain? Anyone? Do you know anyone who suffers from lower back pain? Hi Janet. Nice to meet you. Thank you for joining us. Now, is your lower back pain every day? Do you get lower back pain every day? Or some people may just feel it once a day. Or it's ongoing, constant, achy, stiffness. Or some of you get sharp pain. Now today I'm going to show you whatever the pattern of the back pain is, or whether it's sharp or dull or stiffness. And the technique that I'm going to show you today would get you instant relief from your back. Hi Winter. And think about it. We are on lockdown today, day 5 in New Zealand, right? There's a lot of patients, a lot of you maybe in lockdown too. You can't go out, and it's with pain, with lower back pain, and you've probably been going to an acupuncturist, chiropractor, osteopath, physiotherapies, and their treatment wonderful. They provide wonderful treatment for you, and you get a lot of relief from it. But due to lockdown, then you can't do anything now. Now here is the reason why I'm doing this live video, because I want to help you to get some relief. And I guarantee you, it'll give you instant relief if you get to the right point. Alright. Now, do you want to learn this technique? If you want to learn this technique, please say yes down there. Whether you're on YouTube, you're on Facebook, please say yes. Now, a few things that I'm gonna cover today. One is make a simple examination. A very simple examination that I'm gonna show you. Second is I'm going to show you a very simple technique that is on your hand. Then you can work on to get instant relief from lower back pain. Hi Rose, thank you. Yes, acupuncture is wonderful treatment. Thank you. Now, we know acupuncture is wonderful, and today I'm going to show you the acupuncture point that I normally use for my back pain patient. And this strategy that as I also show my patient, I say, wow, we tested out now, this point's working for you. Please, when you go back home, we expect the pain come back. Unfortunately, I'm not God. I can't cure you. I can't make the pain go away and never come back. Right? When we hurt our back, it's easy. You just had a fall or sleep on the wrong side, and pick up a box and you feel the pain. But to get rid of the pain, it takes time. It does take time. And to get the result from to figure out a technique, whether exercise, strict acupressure point, massage, or chiropractic treatment, osteopath treatment, physiotherapy treatment, they all work. But some of them are not working, right? They're all good for back pain. But some of them are not working. You can try for many times. It doesn't work. Right? Now, the most important thing is we need to figure out a way to find out whether it works or not. Whether you respond to that particularly treatments or not. Same as in acupressure point treatment. Now, we're going to run a test. So whether you respond to it or not, if you respond to it, keep going every day. And one day, you get pain-free from lower back pain. You get rid of your lower back pain. Does that make sense to you? So be with me. The first thing that I'm going to show you is test it out. So it's better that you have a pen. Okay, you have a pen on your hand. And get a paper. And then I'm going to write down something. Pen level. Over here. From 0 to 10. So ask yourself this question. How bad is the pain? How painful is it out of 10? Okay? Now, if you're sitting there, you can feel your pain. Then you can put down whether it's 4 or 5 or 10. Of course, I don't feel the pain. So I put 0 out of 10. Okay? 0 out of 10. For you, if you feel the pain, whether it's 10 or 9, when you're sitting there, you're not feeling anything, you put it down. Now, at worst, how bad is it when it's getting worse? What would it be? Let's say if you have 3 out of 10 at the moment. Sitting by there, listen to me, and then you, yes, I use it to all my clients. Thank you. Fantastic. Now, at the moment, if you're sitting in there and listen to me, watching this live video, and you feel pain in your lower back, and that's, let's say it's 3 out of 10, you put 3 out of 10. And also ask yourself, when it's worst, how bad is it? It could be 10 out of 10. Let's say it's 10 out of 10. At worst. Okay, 10 out of 10 at worst. Okay. Now next, stand up, or by sitting down, you can do that too. I'm going to stand up. Bend forward. So, if you have a mirror, it'll be better. If you have a family member who can take a photo for you, that's even better. Right? Because two things that we want to find out. One is pen level, one is ROM. Range of movement. Whether you can perform the normal range of movement or not. Okay? So forward and backwards. Well, for you, you are not you don't have to write down exactly it. Better just take a picture, So there's 3 ways you need to do that. Forward. Okay. Normally we be able to forward and go down. If you only feel this way and you start to feel pain, then take a picture of that ankle. Right? Because when we do this massage or acupressure point, we need to test it out whether it works or not. Okay? Then, especially you don't feel pain, like I don't feel pain at the moment. I have no pain in my lower back at the moment. And it's good to test out range of movement because this is the measurement that we need something that to measure whether you respond to the technique or not. Okay? So, let me try it myself first. You should try it too. Okay, I'm gonna put it down. I don't feel pain. Backwards. Okay, when you do backwards, go down there. Better put your both hands on your back and try to do this that way. I don't feel pain. So 0, 0. And sideways. So bring your shoulder to one side, then the other side. Okay, no pain, no stiffness. So one other thing, ask yourself whether it's stiffness or not. Whether there's any stiffness or not. Okay, when you do it. Okay. And number 3 is turn. Like you driving car and you turn back. There's no pain for me. But what about you? Then when you write down the pain level, you also want to point out what sort of pain. What kind of pain is it? Is it sharp pain? Because if you do the point later on, when I show you, you perform the point, and if it was sharp pain, and after you do it, and the pain, let's say it's still 5 out of 10, but it's not as sharp. The intensity is still quite bad, 5 out of 10 before acupressure point, and after that, still 5 out of 10. But it turns sharp pain to dull ache or stiffness. You are winning. You know what I mean? Okay, now test it out first. It's rather important. Rather important. Okay, so write all this down and test it all out. Now, next, I'm going to show you some acupressure points right now. First, I'm going to show you the tool. What sort of tool can you use? Thumb. When doing your thumb, your knuckle press it in here, index fingers. So using a thumb like this. Okay? Second, use a knuckle. Index fingers, fully bend it, and use your thumb to press it on the fingernail here to lock it, to stabilize your index fingers. Okay? So stabilize index finger, and then you can do the point over here like this. Okay? So that is the two tools. Number 3, I often use my knuckle in my thumb. So make a fist, give me a thumbs up like this, and press your tip of your thumb onto the knuckle, the joint over here. Good morning. We're actually 5 o'clock p.m. at the moment. But thank you for joining me. Okay, look at that. This is where you can use it too. Alright. Now, this one, or this one. 3 different tools. Of course, if you have massage device, you can use it too. And I also use chopstick. Well, if you find chopstick, you find in the end of the chopstick here is quite round. It's not sharp at all. Some of it is too small. It could be quite sharp, especially the Korean or Japanese chopstick. They're quite fine in the end. It's actually quite sharp and not good for acupressure point. And use the wooden one or bamboo one, and they generally okay. I got some bamboo one. They're quite sharp too, but this one is good. This one's good, okay? And you can use that instead of your fingers or knuckle, okay? That can do it too, all right? Right, let me show you the acupressure point right now. I find a pen that I can point out the pin, the things for you, the point for you. Okay, there you go. Now, when it comes to acupressure point, there are 2 strategies. Always, when I talk about acupressure point in my teaching, I always say there are 2 strategies. One strategy is local point. Right? What it means is pain over here in the lower back. Then you go ahead and choose some point If you're an acupuncturist, you know the point. Or, a massage therapy or a physiotherapy, it always rub on the muscle around here, press at some point, some trigger point, and release the trigger point. That is one way to do it. If you respond to that technique, keep going. But when it comes to lower back pain, it's difficult. The difficult things in here is you want to rub your back yourself, you need someone to help you, right? So the great thing about acupuncture is it comes with another strategy. It's called distal point strategy. So local point, distal point. So with distal point, you must understand the meridian. How the meridian connect to the organs, and how when the organs function better and the blood flow on the meridian will be better. When the blood flow increase in here, it unblock the blockage. That's where it will relieve your pain. Does that make sense? For me today, to show you acupressure point in this page, in this Facebook page, then I'm not going to show you which point is for which meridian. For example, this point over here, we work for the pain on the side, lower back pain on the side, that's gallbladder meridian. And the pain over, the acupressure point over here, work for pain in the back. Alright, so I'm not going to show you this. I'm not going to teach you which points for which. I'm going to show you all the possible points along here. Then when you hit the sensitive point, we call RC point, the painful spot, the tender spot. When you hit it, just massage it. And it's going to give you relief in whether the pain is on the side, back, middle, or here, or even tummy pain. Okay? Alright. This is how you do it. So follow me. Bring your hands up. Between the first and second metatarsal bone. So go to the joint, to the end of the joint. So on the soft part, over here, we call 灵骨 point. Or in Chinese, there's another word called 下颌骨, which is the bottom of 颌骨. Because this is 颌骨 point, this is the bottom of 颌骨, or below 颌骨. Right? So over here, you can find a point that's very sensitive, and that's very good for back pain. All right, over here. Now, how do you reach the point here? So, use your thumb, 4 fingers around here, hold it like this, and your thumb going to that way. Press it, and in the corner of both this bone and this bone, first and second, and on, press it. And again, when you press it first, you press it and rub it. Press it and rub it. Do not do this. You are rubbing on the skin. That doesn't work. You have to actually press it. So you have to press it and rub it. When I say rub it, you see the skin is moving, but it's actually pressing the tissue under the skin. The point is under the skin. It's not on top of the skin. Okay, it'll work for you only when you push it down and rub it, and you feel the tension. You feel the tenderness spot. All right, over press it and rub it. So do it with me and let me know whether you find that point or not. If you can't, please say no. If you can't find a point, please say yes. And I know that you got to the right point. If you don't get to the right point, it won't work. Alright? Are you following? Now, how long should you do it? Press it and do it for 1 minute, 60 seconds or 30 seconds. When you do 30 seconds, you can do this, or even this. It's up to you. I'm going to do this. I'm going to use my knuckle to press it. Okay, when you press it, you're going to move your hand around, okay? Different direction to get the point. So the point normally toward to the bone. You get it? Okay, cool. Thank you very much for all your response. You're so kind. Okay, press it and wrap it for 30 seconds. And another thing that most people won't tell you that, but when I share, I really want to help you, and I really want you to get relief from this technique. So the best way to do it is while you press it, move your back. Okay. While you press it, if you have pain when you fall forward, and you do forward and backward, forward and backward. So that is the extra range of movement that will increase your range of movement to make it even better. You don't have to do that. You can do all this. You can do all this point first. Hi, Jane. You can do all this point first. Then you do second round with the exercise. All right. This is one thing that you can do. So press over here. The second point is go to the second bone in here with the index fingers and middle fingers. Same level over here. Okay, and you find a point. All right. So let me show you here. This is a bit tricky. So when I say tricky, can you see when my index finger is moving? Can you see the tendons over here? That's where it becomes tricky. So between here, the bone over here and here, let me draw the bone for you. Let me draw the bone for you, and you know what's going on. Oh, it's not working. Here's the bone. Here's the bone. And I'm going to use a different color. Oh, green will be fine. Okay. You see? There's the bone, and there's the bone. What about here? This is the tendons. So between two bones, there's a tendon across between them, which means over here you have two acupressure points. The reason I want to show you this because most acupuncturists miss this one. I miss this one too. When I first do this technique, I do acupuncture needle in, and it works for my patient. In some cases, it doesn't really work for them. And then I started searching. I said, why it doesn't work for this case? And then I go more precise and find, oh, the acupressure point is not as bad in here. There's another one that's very painful over here. And I hit the spot. I put a needle over here. Bang. Pain will get instant relief from the pain. Okay, so I want to show you this in here, as this is very important. A lot of people, we all learn from Balanced Method Acupuncture, Dr. Tan. We all think about there's only 5 points over here, but it's actually 6 different acupressure points. You have to check all these 6 acupressure points, otherwise some of the case it doesn't work. I talk about this because I'm teaching acupuncturists to learn this as well, this technique as well. And I shared this with one of my students, and he said that he'd been learning balanced method acupuncture for a long time, and he recently suffered from back pain, and he keep treating himself, putting 5 needles in here. It didn't work for him. Not until he found my video, he watched it, and he realized that there's another point over there, and he used his fingers going to that point. Ooh, this point is actually much more sensitive than the other one. Therefore, he put 1 needle there, bang, the back pain is gone. Okay, that's what it is. Okay, let me show you over here. So use your fingers. You push it down here. Again, you're not pushing on the bone, you're actually pushing on the soft part, but it's actually between 2 bones, but closer to middle fingers. Press it in here and find it. Is it painful? Is it sensitive? Ask yourself. If it is, go for 30 seconds. Go for 30 seconds. Then you also want to go across the tendons over here. And this tendon is very close to the bone on the second one. Second metatarsal bone, all right? It's very close. So you have to dig it in and press it. And most of the time, this is the most painful one. Again, I don't have any sensitive point in here. My 2 points over here between the second and the third bone over here, all good. But if you have it, please press on it. Again, you can use your knuckle here, the knuckle over here, or your thumb, or a chopstick. I'm going to do chopstick today. Even though I don't feel it, I'm going to just show you how I do it. All right. There's no tendon spot over here, but I'm going to do it like this. Press it down and go. It's painful, but it's good. It's good pain because it's going to relieve your back pain. 30 seconds, and you can find the other one. If you hit it, go for 30 seconds as well. You can go for 60 seconds, but I suggest you go for 30 seconds right now, or even just 10 seconds and do it for 3 times. Count to 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and repeat for 3 times. That's it. Okay? The next one, same level again. Oh, we found one in here. And there's another one. There's another one. So far, we go for 3 points. 1, 2, 3. Two. Are you following? 3 points. Next, we're going to do another one. Between the 3rd and the 4th. Again, go down to not on the bone. Remember, never push on the bone, just on the soft part over here. If you hit the point, then wrap it for 30 seconds. This is the 4th point. Again, I don't have any sensitive point over here. I don't have any sensitive point. Oh, I do. Sorry. The reason I say I don't, because I push it in here, and when I go the direction a bit toward to the bone, and I start to feel that. So when you dig it in, the direction that you go to, this is the middle point. You can go up and rub it, down, the same point, but you point it to a different direction. That way, and sideways, and the other sideways. So when I do this one, I go to that way. This is the middle. This is to the side over there, and this is another side, and that's toward to my finger, tip fingers, and that's toward to my wrist. And toward to my wrist, I actually feel pain over there. That's where I'm going to do this. Oh, this is very painful. Again, for 30 seconds. Well, are you following? Do you find the points? Please let me know. If you find a point, please let me know whether you find a point or not. I'm going to do it a bit longer in here. Okay. Quick one. It's about this. The next one. Go from here to here. Right? This one is between the 4th and the 5th. Dig it in. You found it. Good on you. Fantastic, Jay. Okay. Rub over here. So between this, and you find that in here, in this one, some of you may find my one is very sensitive. I always get very sensitive over here. I don't know why. The reason I said I don't know why is because this is not for my back pain. I don't have back pain. But the point in here, when it's sensitive, it may be linked to my organs. It may be linked to my neck or other places, which I haven't got the symptoms yet. But when the sensitive points start to appear, which means one part of my body is actually out of balance. So I always, every week, when I go to tempo, I sit there and I listen to the class and I start to check my hand. So I actually do it every week. I don't do it every day. To be honest, I don't do it every day because I don't have symptoms, but I check it every week. And I often found that this is the point and that point. That one and that one, often I can find sensitive point. This one, I'm doing it now. It's so painful. I tell you, it's so painful, but it's good. It's good pain. So my mission and your mission too is to get rid of all the sensitive point. Right? When you start to get back pain and you do it, it's so painful, then it'll give you relief. But you'll find that when you don't have back pain, the point is generally still there. And your mission is to get rid of the sensitive point. And when you get rid of the sensitive point and you need to check it often, I suggest you check it often. Why is that? Because when your lower back start to get weak, let's say the function of your lower back or the organs, this is good. When it drops down to here, is where you start to get pain. The pain present in your back. From here to here, you feel pain, right? When the function of the meridian or your organs is up to here, between here and here, you don't get symptoms at all. But guess what? With the acupressure point over here, when your function is start to get low, from here to here, which you're not getting any, you can't feel any pain in your back yet, but that point begin painful in here. When you test on here, you find some tenderness spot over here, and that is where when it drop to here, you don't feel pain yet, but start to work on it because you can bring the function up, and up. And guess what? When you pick up a boxes, when you step in a funny position, you won't get any back pain. That is according to Chinese medicines. That's what we think about it. Okay, this is the good way. This is a very good way to prevent back pain. If you suffer from back pain for a long time and it works for you, my suggestion is for you, do it every day. Even you don't have back pain, just make sure there is no acupressure point in there. Does that make sense? Right. This is the one. 1, 2, 3, 4, 5, 6. 5. Number 6. over here. Thank you for sending the love, pressing the love in thumbs up for me. Thank you. The last one. So this is a bit tricky. The reason I say tricky is because there's a big muscle in here, and difficult to do this because when I do this, I always miss the fingers. You know, I do this and then the fingers gone away. It doesn't actually stick in there. So one of the way to get the fingers, tips or knuckle or this stick to the point is you have to press it next to the bone. Next to the bone. If this is the bone, you need to press it just right next to it. Right next to it. Not on the bone, right next to the bone. So that's how you get stable on the point. So you feel the bone over here and you press it down here. Same level from here to here. Same level. And next to the bone, and then you press on it. You can use a knuckle. I like to use my knuckle because it's stronger, and press it. So I press from here to there. I press from here to here. So together, I push it together and find it. So this is the harder one to find. I find a lot of patients can't find this point, but tell me if you find it. Are you getting it? Can you find it? This is the harder one. And again, dig to the bone. Not on the bone, it's right next to the bone, but very close to the bone. All right. I have a little bit. Okay, I have a little bit. Okay, work on it. Now, for those of you, if you feel pain, you should get immediate relief right now. Ask yourself, how bad is the pain level now? If it was 10, it should drop. Whether it dropped to 0, 3, or 5, or 8, I don't know. You tell me. Okay. Now, I know some of you in acupuncture, practicing acupuncture as well, and those are the points that I show my patient to do at home, and those are the points that you can put needles on as well. It's very, very good for back pain, lower back pain. Okay, this is just one of the strategy I use for my patient. There are a lot of strategy, and as I mentioned before, all the strategy, acupuncture, physiotherapy, chiropractor, osteopath, massage therapies, all good for lower back pain. But one thing is, whether this strategy is right for the patient or not, we test it out and we figure it out. If it's working well, please keep going. Especially in the lower back pain, we always require, a practitioner to help us. But when it comes to self-treatment at home, this is something that you can do. Do you only do this on your right hand? No, Jane, you can do it either side. And you may find one side is actually work better than the others. Yeah, one side is more sensitive than the other. If you find both arms, both hands points are very sensitive, then please do it both. This is self-torture. Okay, cool. Well, thank you for joining in, and test that out. And do it once, 30 seconds for each point. And the second one, you can, if you want to go further, it'll work very well. Is when you do this point, there's extra. Okay, there's extra. This is even better. If you have pain when you bend forwards and stop, you can't go any further. So my suggestion is go for 30 seconds, 30 seconds, 30 seconds, 30 seconds. All of them 30 seconds. And the second round, you go for 30 seconds. And then most of the time you find, okay, you were there, stuck in here. After doing this, you can go even further. But if the pain's still there, it does drop, but it's still there, or it hasn't dropped yet. Anything. try it again while you press it for 30 seconds and do some movement with it. Bend forward, and when you feel the pain, you start in here, back. And keep while you're pressing here and move. Or you can move like this. And you can move like this. You know what I mean? So when you turn that way, you feel the pain. You want to move it. You want to press it at the same time. During you press it and move to that direction, you feel the pain, stop it and go back. And keep going this. Alright? Same as if you're going backward or sideways or turn your back and test it out one by one. And then you're going to find out one point particularly that is working. It will relieve your back pain. One of the point will relieve it very well. And that's the point when you experience it, when you get to the point, then each time you feel the pain in your lower back, you know which one will work better for you. It's just straight away go to that point, hit the point, and bang, the pain will be gone for you. Does it make sense? Alright, now for those of you, if you're on YouTube, please subscribe to my channel, give me a thumbs up, and leave your comment down there. If you're on Facebook, please give me a thumbs up, share this live video on your post, so because I want to help more and more people, particularly in lockdown time. You can't go for treatment. There's something that you can do for yourself. Acupressure treatment for yourself. Further on, please put a heat pack on your lower back. It will help you a lot. Alright? That's it for today. And if you don't know who I am, hey, go to the website www.balancetcm.co.ng. If after the lockdown, if you need any appointment, you need us to help you further, if this is not working for you, or it works, but you need some more help, it works, but it comes to certain level that you can't get any improvement, that is the time you need to visit our clinic, because we need to address which organs that actually out of balance, that preventing you get any improvement from your acupressure point. Does it make sense? So then call us 0784679994. Alright. So we have clinic in Hamilton, Raglan, Auckland. That's it. We haven't got clinic in Taonga yet. But hopefully we will have one. Right, stay awesome, and I love you all, and thank you very much for giving me the chance, the opportunity to share my knowledge with you, to help you. And please, I want you to help me too, because I want to help more patients and get so please share this live video on your post. And if you're on YouTube, please share this as well. Take the link and share it on social media and send it to your friends. And on Facebook, you can tag the person's name in this under this video, and so they can watch this video. Stay awesome, and I'll see you next time. I'm going to organize Daisy to give you a talk about knee pain, probably on Tuesday. We're organizing the time. Stay awesome. See you next time. Bye bye.